interpretation into English, French, and Spanish, and you will be able to ask questions during the session by using the Q&A button. Please remember to identify by saying your name in the question and also the media outlet. We're going to start now with the remarks by Dr. Carissa Etienne, who will be sharing an update on the COVID-19 situation in the Americas and also vaccination.
Dr. Marcos Espinal, subdirector.
We have Dr. Espinal, who is with Dr. Carissa Etienne, Dr. Ciro Ugarte, who is the Director in Health Emergencies, and Dr. Andrea Vicari, Chief of the Unit on Infectious Threats at PAHO. We start with the remarks by the director, and then we move on to questions.
The floor is yours. Thank you.
Luciana. So a very good morning. Thank you for joining for today's press briefing, and our apologies again for this late start. COVID cases have been rising in the Americas for the past 8 weeks. Last week, our region reported more than 1.2 million new cases, a relative increase of 11% as compared to the previous week, and 4,069 new deaths, a 19.4% increase. In North America, the United States saw a 2% increase in hospitalizations and a 4.2% rise in ICU admissions for the 7th week in a row. Mexico reported over 31,000 cases, a 71% increase. In Central America, over 27,000 new cases were reported, a 32% decrease compared to the previous week, and a reversal of some 7 weeks of rising cases. Deaths also decreased by 36%. In South America, cases increased by 20%, with over 417,000 new cases reported. 7 countries reported increases in weekly deaths, and weekly cases in the Caribbean increased by 3.7%, while deaths decreased by 19% as compared to the previous week. In the 22 countries and territories with available data, 9 countries reported increases in COVID-19 hospitalizations. Of the 34 countries and territories with available data, COVID-19 hospitalizations increased in 15 of them over the prior week, and ICU admissions rose in 10 countries and territories. Our health systems are coping because the majority of people in the Americas are vaccinated against the virus and therefore better protected against severe disease and death. However, too many people remain unvaccinated, and they are at much greater risk of needing a hospital bed or even dying from COVID-19. The demands on health services for ambulatory care for long COVID are another factor that our countries must take into consideration. We have the tools to protect people against severe disease or deaths from COVID-19. The middle of the year is fast approaching, and we must take stock of how far we have come towards the WHO global target of reaching 70% of eligible people in every country. 16 countries and territories in our region have met this target thus far. Several others are close. Colombia, Bermuda, and El Salvador have all reached at least 65% of their people and could accelerate coverage in the next few weeks. During vaccination week in the Americas alone, participating countries delivered 12 million doses of COVID-19 vaccines alongside their campaigns for routine immunizations. We should celebrate this progress, but really we have no time to lose. 24 countries are still working towards the 70% coverage target, and 11 countries and territories have yet to reach 40% coverage. We have enough vaccines to protect everyone, including the most vulnerable to COVID-19. Since the start of COVAX in 2021, PAHO's revolving fund has delivered over 142 million vaccines to countries in the Americas. Thanks to the commitment of donors and national governments, we now have the supplies and financial and technical support to help countries reach the 70% target and even go beyond it. Our priority now should be turning vaccines into immunity, ensuring that the doses that we have are making it into people's arms and saving lives. For this, we need to be focused and strategic. It is crucial that countries redouble their efforts to protect those most at risk. Vaccination the elderly, pregnant women, immunocompromised persons, and health professionals protect them and our health systems from the worst of this pandemic. As cases rise, protecting the most vulnerable becomes more important than ever. However, public health measures are being cut back in some countries, and the emphasis of offering COVID-19 vaccines to everyone is waning. I hereby call on country leaders in our region to focus their resources and capacity to reach the unvaccinated. For this, we will need to tailor efforts to address the concerns that still surround vaccines. Overwhelmingly, data show that countries now administer booster doses far more frequently than they deliver primary series doses. And this means that more people who completed their primary series are getting the boosters, but those that haven't yet received any doses remained unvaccinated. It is worth repeating that the vaccine is safe and effective. Over the past 2 years, we have delivered more than 1.88 billion doses safely into arms in our region alone. And we have an effective regional surveillance system to identify and review serious reactions post-vaccination. We have found very few of these events. The overwhelming majority of vaccinated persons experienced no adverse effects and now enjoy protection against COVID-19. Health departments and their teams need to collaborate with communities to monitor trends and rumors, collect information on attitudes and beliefs, and use that information to inform their outreach strategies. We must start thinking differently about new ways to promote vaccines, to develop tailored strategies that address specific concerns in areas where the coverage is poor, and to deliver these messages in a context of openness and cultural sensitivity. And this includes finding creative ways to deliver vaccines close to home. When we first rolled out vaccines, they were being delivered in grocery stores, at schools, and even at the local square or in marketplaces. Now, some countries are scaling back these vaccination centers. It is important for us to continue to use our resources wisely and try to reach people where they are, especially in the most vulnerable populations. And lastly, the COVID-19 pandemic is not a short-term problem. Countries must integrate COVID vaccination into their routine national immunization programs. The latest Essential Health Services survey conducted by PAHO showed that routine immunizations were heavily disrupted by the pandemic, and that many countries had difficulties maintaining other routine health services. Also, with COVID-19 vaccination activities, the duties of immunization staff multiplied exponentially, and governments did not hire enough experts to manage them all. Fighting COVID is now part of our routine. We are at a moment of the pandemic where we need to take the long view. We must integrate COVID vaccination efforts into our national immunization programs so that we have robust services in place to deliver routine vaccines, to expand COVID coverage, and to better prepare for future emergencies. This virus is not going away anytime soon, and recent cases of monkeypox and acute hepatitis show that we must respond quickly when there is a new risk on the horizon. Our health systems are only as strong as the workers that power them. Building more resilient health systems must include investing in the people that keep them up and running. During the pandemic, many positions in national immunization programs were overstretched as new needs arose, as resources and people were redirected towards the emergency response. Today, our region faces a shortfall of 600,000 public health workers. To face the long haul with COVID, to recover from 2 years of disruptions and stay prepared for what the future will bring, we will work to support and train the necessary healthcare providers, program managers, and program staff that are so badly needed. Now is the time for countries to take everything that we have learned from the response to the pandemic and commit to investing in stronger, more resilient health systems.
Thank you, Director. We stay with you for the first question that we received in advance per email about monkeypox. Journalists also in the chat are asking for an update and also asking what is PAHO doing on monkeypox now that we have more cases detected in the region. Thank you, Director.
So thank you for that question. And we do know that there are many questions surrounding the outbreak of monkeypox, which has been renamed by PAHO, by WHO, sorry. So PAHO has activated our emergency response procedures and is providing support to countries to primarily detect cases and contain transmission. We know of 230 confirmed cases in the region. The majority of those are in the United States and Canada. We know that this number will change as countries detect more cases. But our priority now is to support the detection of the virus. And this is essential to characterize the spread, to disrupt the chains of transmission, and to stop an outbreak. So we have shared technical guidance for laboratories which were not familiar with the virus hitherto. Last week, we carried out a first training in Brazil, organized with the country's Minister of Health, to strengthen the capacity of national laboratories in Bolivia, Colombia, Ecuador, Paraguay, Peru, Uruguay, and Venezuela. Participants received hands-on training on real-time PCR, as well as critical supplies such as primers and probes to be able to carry out the tests when they return to their home countries. Following this training, Venezuela was able to confirm a first case of the disease, a person with travel history to Europe, thanks to PAHO support. And this week, we are carrying out a similar training for the Caribbean, including experts from Bahamas, Jamaica, Guyana, St. Lucia, and Suriname that will take part in the training in Kingston and receive the supporting testing materials as well. Another training is planned next week in Mexico for Central American countries, Cuba, and the Dominican Republic. With that, we will have trained and provided critical supplies for monkeypox detection to most countries in the region. We are also providing technical guidance on the clinical management of the disease and advice on targeted communication strategies to prevent the spread among at-risk groups. We are also in touch with countries and producers with regards to vaccines. Based on the current risk assessment, mass vaccination for monkeypox is not required nor recommended at this time. Vaccines can be best used for specific groups, such as healthcare and laboratory workers, or for close contacts after exposure to prevent the onset of disease. And PAHO is working to ensure that countries have access to vaccines for these groups should this become necessary. I just want to reaffirm and reassure everyone that the risk to the general public from monkeypox remains low. And we still have the opportunity to contain this outbreak. Thank you.
Thank you very much, Director. Muchas gracias. Pasamos a las otras preguntas.
Thank you very much. We move on to the next question by journalists on the issue of COVID-19. We start with Patricia Rodriguez Calva from Imagen in Mexico, and also a question by Ana Yacine Insulza from Bloomberg Television, and also Blanca Valadez from Mexico. Patricia is asking, does PAHO think that Mexico is already having the 5th wave of COVID-19? If the answer is positive or negative, what are the reasons? Dr. Vicari? Thank you very much for the question. Yes, indeed, Mexico has witnessed a continuous increase over the last 5 weeks. And Dr. Etienne already mentioned this in her remarks. Last week in particular, there were about 39,000 new cases that were reported, and it is also important to place this in context. And what we have had with the 4th wave, the one that we had in late 2021 and early 2022, when we had the emergence of the Omicron variant. There are new cases of hospitalization and death that continue to be much lower than what we had during the 4th wave. And it should be mentioned as reference that the peak of this 4th January was in late January, when there were 300,000 new cases reported per week. It is true that over the last couple of weeks, there has been a reason to pay more attention to what is going on, but we are quite below what was the highest peak that Mexico and other countries had. It is difficult to expect, to say what we can expect, whether this is something that will continue or stop. In the US, we had a similar situation and the trend has been reverted. So we need to wait and see what will happen over the next couple of weeks, and it is quite likely that this resurgence could be reverted. I think that this is something that we can wait and see. This is like a roller coaster. We have seen an increase and decrease of cases as time goes by. There could be different reasons. For example, the change in the variants, the seasons, climate conditions that could work together or alone. Thank you very much. I thank you, Dr. Vicario. We move on to a question from Argentina. Valeria Roman is asking, in April, the Dr. Etienne was asking countries last year to maintain their testing capabilities, not to go blindly into the next wave, and to have a clear picture in the region. However, in Argentina, testing was reduced. Some people that already have symptoms and We do not report on the cases that are ignored or the gender of the cases. What are the risks of that the country may go blindly into the current wave? Dr. Ugarte, thank you, Luciana. Thank you, Valeria. Every time that there is a relaxation of the public health measures, we see the conditions for the virus to strengthen. We have seen this over the last 2 years, and PAHO recommends continuing with active surveillance of the new cases of COVID-19. This also clearly includes the implementation of testing for all the individuals that are symptomatic, that have symptoms that are related to COVID-19. With this, we can implement isolation of those individuals who are positive, who test positive, and also for the contacts. So this is the only way to maintain the lower figures, and it would be worse if we didn't know where the cases are, and this will allow the virus to spread to unvaccinated individuals. We also need to increase this will increase hospitalization and number of deaths. The director said it today. There is an increase that is significant in the number of cases and deaths as compared to previous weeks. In this context, several countries in the world are going back, for example, to wearing masks on a mandatory basis among the population, and knowing how the COVID-19 is spread, is transmitted, and knowing what the measures are to prevent the disease, it is unacceptable not to implement those measures and also avoid death. Within this context, it is key to continue with epidemiological surveillance to properly inform the population, and with that, to protect together during this pandemic. Thank you. Thank you, Dr. Ugarte. We now move on to a question from Brazil as to the situation. I will be reading this question in Portuguese, but we do have interpretation into Spanish and English for the question and the answer. The question is by Thales Armiliato.
Thales is asking how PAHO evaluates the stage of COVID-19 in Brazil and the perspectives from now on. Dr. Ugarte, sorry, Dr. Vicari.
Thank you very much for that question. I apologize, I cannot answer in Portuguese. I will be answering in Spanish, if you allow me. So yes, indeed, Brazil, as other countries in the Southern Hemisphere, is having the highest circulation during the year of the respiratory viruses, and this also includes the virus that is the cause of COVID-19. Because of this seasonal factor, we are also seeing an increase in the number of hospitalizations and cases in Brazil, and in the southern area of Brazil, where the seasons are more clearly defined and the weather is milder too. The higher circulation, seasonal circulation of respiratory viruses is also expressed in a higher number of hospitalized individuals at the two ends of the range, in kids younger than 4 because of the syncytial respiratory virus, and also among the elderly. And this is also related to the other viruses that are going back into circulation. And more and more countries will see this higher circulation of SARS-CoV-2, that is to say, the one that results into the COVID-19 together with other viruses. And there will be new waves, recurring waves, and also depending on the number of susceptible individuals, because they're not vaccinated. So Brazil, as other countries, is continuously assessing the situation, and this also includes prevention and control. And at the same time, as we make progress with vaccination against COVID-19 and influenza, the colleagues, the authorities are also adjusting their response to this new reality. And also here with the PAHO, we are supporting these efforts. Thank you very much. Thank you. We move on to the question on therapeutics by Matias Lowy from Argentina, Medscape in Spanish. The US and many central countries consider that antiviral pills such as Paxlovid are key to management of the pandemic, but in Latin America, it is almost impossible to have access to that medication. Are you concerned about a repeat of this situation of inequality, the same situation we had with the vaccines, or having vaccines and levels that are relatively high in terms of coverage in the region? We would say that this is not so important in terms of public health. Dr. Espinal, thank you very much. Very important question. It is that the use of Paxlovid is inexistent because there are some countries that do have bilateral agreements and that can have access to the drug. But in terms of PAHO, we do recommend the use of Paxlovid and other medicines such as Tosumabib, that is a very important drug. And in the case of Paxlovid, we are working with the ProST partnership, that is the accelerator to have access to COVID-19 tools such as drugs and vaccines. This is a tool that was created by the World Health Organization to make sure that our countries do have access to the drugs. And I do have the pleasure to tell you that right now we are working so that 20 countries in the region receive access to Paxlovid through donations. And also in connection to other drugs, we're also working in 18 countries in the region, and the countries will be receiving the donations. This is a medicine that, or a drug that is only recommended based on the severity of the disease and also to avoid severe cases. But we're working on that, and the donations will be reaching the countries in due course. Thank you very much. Thank you, Dr. Espinal. We have another question from Panama on the situation regarding COVID-19 in the country, and regarding, as it's saying, in spite of the high number of vaccinated individuals, countries such as Panama will continue to have peaks or new waves of the pandemic. What is your assessment of the pandemic in Panama? Dr. Vicari, please. I think that you have already answered something along these lines, but once again, yes, indeed, Panama, as we have seen, is in a very similar situation to that of other countries in the region, not all of them, but other countries are reporting an increase in the number of cases. There are 4 countries in Central America that are also having an increase in the number of cases, and they have done this over a couple of weeks. And this is something that we see in other countries. As I mentioned before, for Mexico, we can expect a decrease in the upcoming months and years, but there are several factors that work together. So in connection with that question, we should recall that the main purpose of the vaccine is to protect against severe disease. It is not to control the transmission of the disease. So in spite of having high coverage that is uniform and at the same time includes risk groups, we can continue to see the circulation of the virus. It is important that that increase should not result in a high increase in the number of hospitalizations or deaths, because that's where we have the vaccine for protection. Thank you very much.
Una pregunta sobre las medidas de salud pública de Costa Rica.
Thank you. A question from Costa Rica. Juan Diego Cordova from La Nación asks, what's the position of PAHO regarding the mandatoriness of the COVID vaccine, and also whether the use of masks should be mandatory as well? Dr. Ugarte, thank you, Luciana, and thank you to the journalists who have asked this from Costa Rica. I'd like to start by saying that the policies regarding immunizations are national decisions. The countries make decisions about this according to the context. The recommendations from WHO PAHO are aimed at demonstrating safety and efficacy of vaccines so that they're widely accepted by the population instead of imposing mandatory vaccination with no restriction. In this context, the WHO does not support the introduction of a general mandate of being vaccinated against COVID-19 or the requirement of submitting a vaccine certificate either to travel internationally or to leave a country, etc. However, there are some countries that implement this and many travelers who comply with these requirements by the countries. In addition, given the fact that there's wide disinformation about safety and efficacy of the vaccines, we need to work with information and education campaigns so that the priority groups are vaccinated. COVID-19 has decreased, COVID vaccine vaccination has decreased hospitalizations and deaths. So this is proof. And so it is vital for people to have appropriate information so that they make an informed decision whether to be vaccinated or not. However, there are specific circumstances where governments could demand these requirements regarding vaccination, for example, for health workers or for critical service workers, where there's a high risk of becoming ill, of transmitting the disease to others who are under their care, or that they have to miss working on essential services for the community. In these cases, it may be possible that the only correct decision would be to be vaccinated. And this is related to the applicable legislation in the jurisdiction when this happens. Let's remember that in many countries, pediatric vaccinations are mandatory in school contexts, and this has been widely successful to guarantee coverage extensively to reduce deaths and even eliminating the presence of some diseases. So the coverage of the regular immunization program in Costa Rica is, those coverages are among the highest in our region. So it is necessary that regarding COVID-19 vaccine, everyone should review their own personal responsibility to protect themselves, their family, their context, vis-a-vis what the law requires or not, and whether there is commitment by the organization with Costa Rica to evaluate mechanisms regarding mandatory or mandates. Uh, Costa Rica has enough vaccine stock for the whole population. Luckily, most of the population understands the personal and collective benefits of the vaccine, and they are being vaccinated. PAHO, through our technical team at the PAHO office in Costa Rica and at regional level, will continue to support the country as we've done with the participation of PAHO, participating in the National Vaccination Committee and proposing adjustments and giving guidance according to subnational and national situations. Thank you. Thank you, Dr. Ugarte. Now, Gabriela Solórzano, Canal 12 from Nicaragua says PAHO has said that by June, they had prepared to have a shipment of vaccines arriving in Nicaragua. Uh, is there a date for the arrival of these shipments, and are they donations or are they purchases? And also, how do you measure mortality rate in Nicaragua? Yes, thank you very much. This is for Dr. Espinal. Yes, in fact, Nicaragua will be receiving within the next few weeks about 657,000 doses of Pfizer vaccine, and they will also receive two more shipments of pediatric vaccines, which will arrive in June and the next shipment in September. So Nicaragua is working and is receiving and will continue to receive vaccines. Nicaragua also participates in the AMC, which is the enhanced market commitment, which allows it to access vaccines free of charge. So there's no problem on that uh, uh, accord. And so Nicaragua will be receiving vaccines in the next few weeks and in September. We have two more questions, follow up regarding monkeypox in the region. Gisela Salomon from Associated Press asks, could you please give us some details of what other countries in the Americas, in addition to the United States and Canada, have had cases of the monkeypox? Other countries in Latin America. Dr. Vicari, please. Yes, thank you very much. Basically, three countries, Argentina, Brazil, and Mexico, where they have detected a few cases of monkeypox. It is important to emphasize that in an outbreak like this one, the number of cases and the number of countries involved can change over time. So it is important to recognize that there is a great deal of information which is quite fluid in this sense. We would like to emphasize the importance of being able to alert the countries in terms of diagnosing this new virus in our region. It is an important step to be able to be sure of what's going on and be able to frame this within a search for cases and make a determination as to what's going on. So maybe in the next few days and weeks, we will probably see other cases in other countries. And this is something that we are expecting because it reflects what is happening in Europe. And with the movement of people in several countries in Europe, like Portugal, Spain, United Kingdom, where most of the cases are being reported, we can expect to continue to see imported cases and unfortunately also secondary cases. In other words, people who are exposed to imported cases. So it's important to maintain surveillance, which is based on what it is, which is based on lab confirmation. Another question, a follow-up question regarding the situation in Mexico. Manuel Lino from Eje Central asks, given that cases are growing, does PAHO consider appropriate to cancel crowded events, even if they are open air? Dr. Ugarte, please. Yes, thank you very much. The recommendation of PAHO regarding implementing public health measures, including cancellation of mass events to control transmission and reduce socioeconomic impact of the pandemic, is that those who are responsible for making decisions should use an approach based on risk. When they study the measures regarding implementation, in different implementations for the public, and also determining the status of natural immunity. We are seeing a significant increase in cases and hospitalizations in areas where community transmission or where groups of suspect cases or confirmed cases of COVID-19, WHO recommends that in any situation under those circumstances where you cannot keep at least 3 feet of physical distance, people should be wearing masks, both in closed areas as well as in outdoor venues. Unless there's adequate ventilation, it is recommended by the WHO that people should use non-medical grade masks to reduce transmission indoors when there is community transmission. And also, given the risk-based approach, mass crowds can be allowed indoors, and people who have recovered from infection or who have been vaccinated while being masked. But we can do also individualized measures. For example, no quarantine in certain situations, because it is important to take into account that public health measures must be based on risk analysis and on the level of transmission. When there are the highest level of transmission, measures should be maintained for everyone, regardless of their immune status. We have seen that many people who have been vaccinated also come down with COVID-19, and in some cases they die. So this is a preventive measure for all the population. So in situations of medical care where the authorities recommend those measures, including the use of masks, physical distance, etc., everyone should continue to apply those measures, to implement those measures, because this is the best way in which we can continue to control the situation and eventually overcome the pandemic. Thank you. Thank you, Dr. Ugarte. The final question for the director, received by email.
You were at the Summit of the Americas last week. Can you tell us more about PAHO at the summit, if there were any outcomes for health? Dr. Tien, please.
Thank you for this question. And yes, I, with a small team, we attended the Summit of the Americas held in Los Angeles last week. And I really was very pleased that there was an important focus on health. Drawing on the lessons of COVID-19, heads of states and governments of the region actually committed to expand equitable access to comprehensive quality health services based on primary care to move towards universal health. So PAHO was happy to be able to participate in the planning, certainly pre the summit. We participated in several of the streams, including resilient health systems, the need to expand the workforce, the need to ensure production, and including also climate change. So we were happy with the planning to strengthen training and education in medicine, public health, nutrition, and biomedical science research. As you know, the COVID-19 pandemic highlighted the need to improve public financing for health, to strengthen health security, and to improve public health emergency preparedness. And it was really gratifying to participate in those discussions. Not only do we have to prevent infectious disease outbreaks, but also reduce premature deaths from non-communicable diseases. Let me say that we look forward to working with the United States and other member countries in an initiative to train 500,000 public health workers over the next 5 years. As we said earlier, there is a perceived need for at least 600,000 healthcare workers. And COVID-19 showed that health security and economic stability are regional concerns and not necessarily only national concerns. So I think importantly, the summit stressed the fact that to get back on track, we must work together. And I do feel that the Summit of the Americas was a giant step forward in that journey. I attended a few side events as well, where one of them was a youth gathering, where youth were chatting out what was their responsibility and their role in achieving the declaration of the summit, in engaging with governments to ensure greater resiliency in health and putting people at the very center of development. We also attended one of the side events focusing on women leaders and the role of women in political leadership the role of women in determining the future and charting that course to the future with the full engagement of women at every level of development. So those were very important and very interesting. And as certainly from now, we begin the work of addressing some of the positive declarations that came out of the summit, importantly, to deal with the resilient health systems and importantly, producing 500,000 healthcare workers for the Americas in 5 years. So for us, it was a very important summit, and the engagement of the heads around these specific issues that have great relevance for health was really very important. Thank you so much again for joining us in this week's press briefing.
Thank you very much, Director. We finish on some hopeful good news for the future. Thank you very much. Colegas, llegamos al final de nuestra sesión de hoy.
Colleagues, this is the end of our session today, a little shorter, and I apologize once again for the delay in starting. We will have our next press briefing in 2 weeks, but please be checking your email. We will send you messages. We will have some follow-up questions that will be answered by email, and you can continue to send your questions to us at mediateam@paho.org. Thank you very much once again. Thank you for your participation, and we'll see you in 2 weeks. Thank you. Bye-bye.